Today I'm going to explain the RH sensitization during pregnancy. RH sensitization during pregnancy. This is our today's subject. In the last video, I have explained the meaning of sensitization. I will just repeat the sensitization again. Suppose this is the mother and this is the fetus. Mother is RH negative. Fetus is RH positive. Let this be the placenta. The fetal RBC is here. Maternal RBC is here. The fetal RBC, there is antigen D. D means RHD. Sometimes it is written as simply D, sometimes written as RH, and sometimes the full RHD. In three ways we can write this antigen. So when this RBC enters the blood of the mother, the immune system of mother's blood will detect this RBC with D antigen and they will consider it as an enemy, and this mother's blood will start producing antigens. This is what is called sensitization. The entry of RBC into mother's blood, thereby producing antigens to attack this, to producing antibody to attack these antigens. This is what is called sensitization. So now we have to analyze and see in what are the events by which this RBC can enter the maternal blood. That is, we have to find out the different events of sensitization. Number one, we all know that it is the time of delivery. So, delivery time. This placenta will be broken and erythrocyte or RBC with D antigen may come to the mother's blood, because at the time of delivery placenta is broken. So this is the definite case of sensitization. Again, sensitization means the entry of this D antigen carried by the RBC to the maternal blood. If it enters here, definitely an antibody will be produced in this area. That is what is called sensitization. So, the first event will be the delivery time. Definitely due to the breakage of placenta, there is a chance for this RBC to come here. And the next one is, say, if we remove the placenta manually, so that means manual removal of placenta. Manual removal of placenta. At that time also, there is a chance for this RBC to enter maternal blood. What is the next chance or the next event? That is, suppose while this lady is traveling in a car or motorbike, then she is met with an accident. So there can be some trauma which can give some problem to this placenta due to the trauma. That means due to the injury which happens due to some accident. That is abdominal trauma. Trauma means injury happened by some accident or some other means. Definitely, if it is a big accident, there can be a chance to disturb the integrity of this placenta, and the RBC may pass from fetal blood to maternal blood. So, reason 1, 2, 3. Then what is next? Next chance is a hemorrhage. That means a bleeding, an internal bleeding happens. Or it could be the blood may come outside also. However, the bleeding, of course, it starts from this area, this placental area. So that is, we can say, bleeding before the delivery. So it is antepartum, antepartum means before the parturition, before the delivery. Antepartum hemorrhage. Hemorrhage means bleeding. So it could be a bleeding before the parturition. In that case also there is chance for the red blood cell to come and enter this mother's blood. What is the next event, next chance? Number 5. There is a chance if we evacuate a molar pregnancy. What is a molar pregnancy? What do you mean by a molar pregnancy? Molar pregnancy means it is an anomaly which happens when there is some problem with the genetic makeup or with some other reason. So instead of an actual fetus, there will be small moles, some vesicles with some liquid inside, something like a cyst or something like a bunch of grapes. It will spread all over the uterus, and in that case it has to be removed. That is what is called evacuation of molar pregnancy. Why it happens? Just I will give a little idea about that. Have you seen any ovum without nucleus? Yes, there can be cases like that. For example, here there is one ovum without nucleus, and here is the sperm with 23 chromosomes, and this without nucleus, so there is no chromosome at all. Normally the ovum also should have 23 chromosomes, but in this case this is quite an abnormal ovum, and it is an empty ovum without nucleus. That means without any chromosomes. So if this sperm joins with this and multiplies, it will be coming out with 46 chromosomes, but there is no contribution from the mother side. No contribution from the mother side because there is no nucleus, so there is no chromosomes. This will only multiply after the joining. That is one case. Another case also, suppose is also no nucleus. This is one with 23 and also another one coming with 23. Here what will happen? Both will come inside this ovum and there will be 46 chromosomes, but here in this case also there is no contribution from the ovum. There is no nucleus, so no chromosomes. So this can happen. This is what is called a complete molar pregnancy. Complete molar pregnancy. So there will be an incomplete molar pregnancy also. That is with the same case but with nucleus. This is 23 chromosomes and this also has 23 chromosomes. This will join, but unfortunately this is not going to the fully matured zygote, even though this will join and will come out with 46, but this will be underdeveloped ovum, and so even though it is 46, it cannot give a good gamete. Similarly, another one, 2 sperms will come. This also 23 and this will be 23 plus 23 plus 23. So this will be 69 chromosomes totally. So that is an anomaly. So it cannot give a good gamete. So this is what is called incomplete molar pregnancy or partial molar pregnancy. In both cases there will be molds only, not the exact fetus. But the placenta will be there, but the fetus tissue will not be developed properly. This is the problem. Without nucleus and with nucleus also, this is the problem. Placental tissue will be okay with no nucleus here. Here, placental tissue plus the fetal tissue, but it is not fully developed. There is anomaly. So that is what is called molar pregnancy. 2 types. One is complete molar pregnancy and other is partial molar pregnancy or incomplete molar pregnancy. In both pregnancies, the fetus will not be developing properly, so we have to evacuate, or by surgery we have to take out all the moles out. So this is what is called evacuation of molar pregnancy. In such operation also there is a chance for this RBC to come to the maternal blood. So evacuation of molar pregnancy. Evacuation of molar pregnancy. In the uterus there will be just moles with some water inside, like a bunch of grapes, that has to be removed. That is what is called molar pregnancy. Then what is the next event or the next chance? The next one is, sometimes we take blood sample from this umbilical cord for checking. With a needle we take blood from the umbilical cord. This is what is called fetal blood sampling. Fetal blood sampling. We will take little blood from the umbilical cord and test it to find out any abnormality. Similarly, the amniotic fluid of the fetus can also be checked. Amniotic synthesis, that is the term used. Amniotic synthesis. Synthesis means aspirate some fluid. Here in this case it is amniotic fluid for examination. That is amniotic synthesis. Take out sample of liquid. That is what is called synthesis. So in that case also we are inserting a needle to take out the sample from the amniotic sac. There is chance, in that case also there is chance for the fetal blood to mix with mother's blood. Fetal blood sampling, that is blood taken from the umbilical cord, also may transfer some RBC to this area. This sampling is to find out any abnormality in the fetus. They will check the chromosomes of the fetus and see whether there is any abnormality in the chromosomes, like trisomy 21, that is Down syndrome. So such kind of anomalies we will come to know earlier. That is the purpose of this examination. Then next chance is, by any chance there is a fetal death happening. Fetal death. by some problem the fetus dies inside the womb, inside the uterus, then also there is chance for this blood, that is fetus blood, to cross the placenta and come to mother's blood. That is fetal death. Another one event is an ectopic pregnancy. What do you mean by an ectopic pregnancy? Let this be the uterus. This is the fallopian tube through which the ovum comes. Here, normally the gamete is implanted on the wall of this uterus. Instead of implanting the gamete here, sometimes it may stuck here and grow in this fallopian tube. It will be sticking to this point and growing there. In that case, the fallopian tube may burst. Rupture will happen to the fallopian tube. That will be a very complicated issue, and that is what is called ectopic pregnancy. Ectopic means out of position. It can be sometimes in the cervix also, or out of the uterus also. In those cases also it is called ectopic pregnancy. The word ectopic means out of position, out of normal position. Here the pregnancy should develop in the uterine wall. It will be implanted in the uterine wall. Instead of that, it is sticking here and growing. Then this fallopian tube will break, and that is also one of the reasons for the sensitization. So that is what is called rupture of ectopic pregnancy. Ectopic, the word ectopic means out of position, out of normal position. It can be anywhere. Normally, it happens in the fallopian tube. Okay. So that is also a chance. If the fallopian tube is ruptured, there is chance for RBC of the fetus to come to mother's blood. Sensitization will happen. What is the next event whereby the sensitization can happen? That is, in the placenta, there are small villi, the singular is villus, through which the diffusion of oxygen and other nutrients are happening. What are required for the baby? It comes through diffusion. in the placenta. So there are villi, and this villi, if you take a sample from those villi, we can check whether there is any abnormality for the child or not. This is what is called chorionic villus sampling. Choreonic means the covering, which covers the baby and the amnion and all. The details of this placenta and all we will discuss in some other video. So if we take a sample of the villus of the chorion, that is what is called chorionic villus sampling. Choreonic villus sampling. This villus means a particular portion through which the nutrients and oxygen and all are diffusing. That is through a villus. So if we want to take a sample of the villus, that is what is called chorionic villus sampling. When we take a sample from this placenta, then there is chance for this red blood cells to enter from fetus blood to maternal blood. That is also one of the reasons for the sensitization. Then next is the normal abortion, that is spontaneous abortion. When an abortion happens, there is chance for these red blood cells to come to mother's blood for an abortion. A spontaneous, a natural abortion due to unknown reasons, abortion. And it can be an induced abortion also. Induced abortion, an MTP. At that time also there is chance for some of the red blood cells to come to mother's blood. Mixing can happen in the MTP time also. Then there is another case that is happening to the cytotrophoblast. What is a cytotrophoblast? Let me explain that. This in the placenta there are two, just I am making a simplified diagram. There are two coverings for this placenta. The first covering is called cytotrophoblast. These cells, blast means young budding cell, that is what what is called blast. So this is the developing site, developing cell. That is why it is called blast. Cyto means it is going to be a cell. Tropho means growth or nutrition. So this actually provides or allows the nutrition coming from here. It is allowing to diffuse to the baby's side. So this is cytotrophoblast. And this one surrounding this cytotrophoblast is another specialized cells which have no boundary. There are multinucleated trophoblasts. This is called syncytiotrophoblasts. Syncytiotrophoblasts. Syn means together with the cytotrophoblast. That is why it got its name like that. Both are trophoblasts, that is the common name. But according to their function, it is called, the first one is called cytotrophoblast, and the second one, which is not having a boundary to the particular blast, it is well nucleated with some special functions and all, like producing human choreonic gonadotropin hormones, which will go to the corpus luteum to keep the progesterone stay as it is, something like that. I will explain later. So this is called syncytiotrophoblasts. So these are the two layers of cells. What happens in the third trimester? This cytotrophoblast is regressing and it is diminishing and disappearing. So one set of cells is regressing, cytotrophoblast. Regression of cytotrophoblast will happen around the third trimester. The aim is actually, when this is regressed or it becomes absent, there is more easily this diffusion can come, and here is the villus and all. This diffusion will be faster if we avoid this one. That is why it is regressing by itself and diminishing and disappearing. So in that case, quickly the particles will diffuse. Along with that, there is a chance for the red bloods also to come to mix with the other blood. So that is also one of the reasons for the sensitization that happens normally in the third trimester due to the absence of cytotrophoblast. So I will write that also here. absence of cytotrophoblasts. Trophoblasts are two types. One is cytotrophoblast, the other is syncytiotrophoblasts. So, how many events? There are 1, 2, 3, 4 up to 13 events whereby the sensitization can happen. Not only at the time of delivery. The other events are also included in the possibility of sensitization. These are the events, sensitization events. So that's all for today, and we will go in the next video some more details regarding the blood groups and all. Thank you very much.